I'm now going to move to our first speaker, who's Dr. Sam Bennett, who's General Manager of Policy Advice and Research with the NDIA in Australia. And I think very importantly, Sam was previously Director of Programs with TLAP in England, and so will be well known to many of you. And also he led national work on integrated personal commissioning in England. So we're going to start with you, Sam, and so welcome to you. And given your unique experience both in the UK at a national level and now in Australia for the past 3 years, I thought it'd be really helpful if you could share a few brief observations about how the NDIS is uniquely different to how the disability, social care and health systems work in the UK.
Thanks, Eddie, and hello everybody that's tuning into the podcast. Been, as you said, a unique privilege, I think, really, that I've had in being able to work on disability and health reform in the UK, and then latterly since 2018, and it's been a really quick 3 years. I've learned an awful lot in that time, working on the National Disability Insurance Scheme here in Australia. So it's given me a good sense of where some of the similarities and differences are, which are interesting to consider in the context of today's discussion. I suppose the first of which will be obvious, I suppose, to many of the people tuning in to the webinar, it's there in the name in terms of the N in the NDIS, but it's a truly national approach. And you referenced this, Eddie, in terms of the various jurisdictional models that the NDIS has replaced. And that's very different to the UK administration of social care, which is a devolved responsibility to 152 different council authorities governed politically by their different sort of flavours of politics. So I think the national nature of the scheme is one of the things that makes it quite uniquely different in terms of its ability to operate at scale and to drive a level of, I guess, consistency of implementation across a significant geography and a very large, significant population of over 430,000 participants, I think, as we speak. Yeah, so 152 different ways of doing things in the UK in terms of implementing a national policy framework set by the Department of Health and Social Care. There's also a difference in scope, which again will be clear from the D in the NDIS, because social care in England is delivered as an integrated service that combines disability and aged care, whereas those things are implemented in quite distinct and different ways within the Australian context. One of the implications of that for the NDIS, being as it is one of the, as you said, the biggest social reforms in Australian history, is a real strength of brand, I think. People know what the NDIS is now. It's been a long journey of education that continues, arguably, but it has a really strong brand and a broad reach across the population, both in terms of people that are employed within the NDIS as well as participants and families that directly benefit from it. And the contrast there with the UK situation, I suppose, is that social care is always struggling, I think, within a broader social policy context and within the public consciousness to differentiate itself from the National Health Service and the various sort of higher profile reforms that have happened within the NHS over various sort of periods of time. So quite a distinctly stronger and more definitive brand of what the NDIS is all about. The I in the NDIS is also one of the things that makes it uniquely different, I think, and that's the insurance bit that Sarah will talk about at length, I'm sure. But the UK social care system, for all of the fact that it's grounded now in a comparable system of individualised funding and personal budgets to the NDIS, is still very much within arguably a sort of welfare paradigm, as opposed to the NDIS context, which is intended to be demand-driven, which is looking at costs across a lifetime and investment in people with disability and families with a view to a return in terms of the outcomes that are received, and also the economic benefits that come from that for Australia at large. And that's quite a distinctly different paradigm, I suppose, to the delivery of social care in England at the moment. Clearly related to that, there's the fact that the NDIS is not, as it stands, a means-tested system, whereas access to a finite state-funded social care system in the UK is absolutely one that depends on your means. There's actually a far higher proportion of people with disability compared to the national population here in Australia that are receiving individualised funding from the NDIS than has ever been the case in recent time within UK social care. So a broader reach in that respect as well. Two final points I'll make to the national nature of it and the insurance nature of it, and the fact that we employ wonderful actuaries like Sarah to sort of run and administer some of the sort of technical aspects of the scheme. We have more data than will ever be the case for social care run through 152 fragmented local authorities that are seeking to do the very best for their citizens in each local area. But the sort of data capability that the NDIS has to be able to determine sort of what works for our participants and to adjust our approach across that participant population is really incomparable to the UK's capability in that respect. And then the final point I would draw out relates to the nature of the individualised funding approach in Australia through the NDIS as opposed to in the UK, namely the fact that under the NDIS, genuinely every one of the 430 plus thousand participants does have direct control over the funding through an individual package, whether that's administered by the agency or as increasingly the case through our data managed through third parties, plan managers we call them here, or self-managed by participants. And what that means is that the agency doesn't have any contracts or very few contracts directly with providers. It's very much a market-driven reform, which again is quite different to the UK, where there's quite a lot of commissioning leverage retained by local authorities in being able to set prices and sort of drive quality at a local level through those contractual arrangements. We're able to do that through the NDIA, but it's difficult and different mechanisms that we need to deploy in terms of enabling supply side innovation and change within the market. And I think it's one of the things that I think we've discussed in some of the earlier sessions through TLAP. There's unfinished work that we need to move to now in terms of how we really seek to support that sort of market side change to more contemporary and innovative models of disability support. But I guess those are some of the things, Eddie, that have stood out to me in terms of the unique differences from my 3 years here now.